A very good afternoon, my dear friends. Today we are going to see the topic determinants of health. My name is Dr. S. Soganathan Soundararajan, Assistant Professor, Community Medicine, PhD, IMSR. Objectives. At the end of the 1 hour session, participants should be able to determine determinants of health, behavioral and socio-cultural conditions, environment, and other factors. This is the picture predicting the determinants of health, which is like gender, information and communication, science and technology, aging of population, socio-cultural, health system, socio-economic, environmental, behavioral, biological, human rights, equity and social justice. Determinants of health. Health is influenced by two factors, that is internal and external factors, genetic and environmental factors, promoting or deleterious. Biological determinants. In this, physical traits and mental traits are determined by genes at moment of conception. Many diseases are there. We will see certain diseases like diabetes, mental retardation, and chromosomal abnormalities. Medical genetics, prevention and treatment, longer and healthy life, genetic screening and gene therapy. This genetic screening and gene therapy is a very big role in medical genetics in prolonging the life. Positive health. Advocated by WHO implies that a person should be able to express as completely as possible the potentiality of his genetic heritage, healthy relationship with his surrounding environment, for example, friends, relatives, and neighbors, everyone. Behavioral and socio-cultural conditions, lifestyle, way people live, behavioral and personal habits. When we see this picture, which is one side, it is indicating us we should not have the habits of smoking and alcoholism, and we should have a very good healthy relationship with the surrounding community and family and friends and neighbors and relatives. Behavioral and socio-cultural conditions. Depending upon the behavioral of an individual, many diseases are arising, that is obesity, coronary heart disease, and psychological behavioral factors. When it is going in a wrong direction, it gives the drug addiction. Behavioral and socio-cultural condition. In our developing country, India, there are certain factors leading to deaths, poor nutrition like malnutrition, and personal hygiene. This personal hygiene leads to more of communicable disease like cholera and everything. Adequate nutrition. Healthy diet must be taken by the individual citizens. Sleep. 8 hours very good soundful sleep is required for a good psychological well-being and fresh activities, physical activities. It's like minimum of 10,000 steps per day. We have to have a good walk, brisk walk for creativity and productivity of mind. Internal and harmonious functioning within the system. It is like when we are very conscious about our health care, our internal system will be very good in nature. External surrounding social environment, we should not go into an wrong practices like substance abuse and everything. Physical and biological and psychosocial aspects plays a very big role in our health care. Socioeconomic conditions. When we are truthful to ourselves, we will be perceiving a very good education, healthy diet, and we can be having a very good employment and housing. Political system of the country. The political system of the country plays a very big role in implementing policies for the healthcare of the people where community participation and engagement is required to make that system of implementations regarding the policies to make it successful. Per capita GNP, reduce morbidity. Healthy lifestyle will lead to the reducing the morbidity and increasing life expectancy and raising the standard of living and giving a very good quality of life. Education. Females play a very big role in education, and the dedication towards it gives the very good education rate among females. When they are being a good readers in future, females are becoming a very good leaders also. Poverty. This education system, when it is we are having a soundful education, poverty can be reduced and high literacy rate is seen in Kerala. Political system. Political system plays a very big role in development of a country, state and everything. Resource allocation depending upon the country's setting, manpower policy is required to make the political strategies and policies implementation successful. Healthcare services. When healthcare services are provided, it should be affordable, acceptable, and it should be accessibility, affordability, acceptability must be there within the public. A very good leadership is required to make a very good strong political system dedicated towards the healthcare of the community. Personal and community services, treatment of disease. When initially itself when the disease has been directed, life can be prolonged and the disease can be cured and the overall stage. Promotion of health, prevention of illness should be the goal of the healthcare services providers. Health services, immunization of children, provision of safe water, intake of and storage of safe water must be there, care of pregnant women and children. When a woman is getting into a stage of pregnancy, antenatal or postnatal stage, there should be a very good soundful environment. Whole family members should be dedicated to take care of the pregnant woman in the antenatal and postnatal period, as well as the child also should be taken care well. Equitable distribution should be there between males and females, and all the services should be provided with the empowerment between the males and females without seeing any discriminations. Social and economic development. Effective health service is very much required for a good care. Epidemiological aspect, improvement of health. By 2020, it was estimated that 1.4 billion elderly people were living. Generally, the citizens of the country, when it's a son or a daughter in a family, elderly people should be given a very big respect and their statements and advice should be taken as consideration by the son and daughter. So only then elderly population can have a better psychological environment and have a better health care. Increased prevalence of chronic diseases are seen among the elderly people. So only elderly people and elderly population requires special attention. Gender. Global Commission of Women's Health is there. Nutrition and reproductive health, health consequences of violence, occupational environment and awareness. Other factors, information, age, medical information, serving needs of many physicians, health professionals, researchers. Food and agriculture. The farmer sectors, farming must be given a very big credit where food is being produced a lot, and education and industry must be their industries must get a very good development. Education should be there among the males and females. Rural development, not only urban, rural also should have a very good development. Policies must be implemented in the social field to then these to strengthen the policies. All the weaker sectors must be made strengthened and corrections has to be made. Employment opportunities, increased wages, family support system. An individual must be there to dedicate towards his whole family. Then the family support system will be very good. Determinants of health. We saw the determinants of health, behavioral and socio-cultural conditions, environment, and other factors. Thank you all.